Yeah, I think if you look at on the healthcare spectrum, what do we have? We have self care, no anything before people get sick. We have primary care. I'll just simplify it in this in a certain way that I
Yeah.
see it. Right. So you have self care. You have primary care, which is the first point of contact for some basic, healthcare relief, maybe, or health problem relief, and then you have specialized care. I think on the one hand side, the specialized care will become in the next 5 to 10 years very, very specialized. And I think any healthcare center, hospitals will become huge centers of expertise with knowledge that will be very hard to comprehend. It will never become something that maybe even retail stores or those kind of companies could manage. So I really see this healthcare at the end becoming very specialized. On the other side of the spectrum, we have self-care, which is becoming super popular, which is becoming very accessible, which has different stakeholders and different views on health even, and that is growing massively. And in between you have primary care, which I believe is at this moment a bit no man's land. It's the entry into the specialized care, but it's getting closer to the self-care as well. And I think what Walmart tried to do is, and many others of those stakeholders, they try to have that, take that middle field. But that middle field is, as I said, to me, it feels a bit like, where is this going? Will it become more specialized and move more into the healthcare sector, or will it become more self care? And I think because of the reimbursement, the primary care setting is part of the healthcare system, and the reimbursement there and all the costs there, and the way that it's operated is very slow, is very heavy. And if that doesn't change, I believe that this primary care setting still will remain no man's land until something changes there. So I really believe that the only way that primary care will change, it will not be by physical players or retail players, because they will focus more on the big markets, which is self-care. But I think it has to do with automation, it has to do with digital health solutions, and the whole, I always say, physicians, pharmacists, insurance companies, sick funds, what have you all, they are the ones that will be most disrupted in the next 5 to 10 years, probably, because they are in between those two magnetic fields that are changing rapidly.